One of the big advances over the last 20 years in prostate treatment with radiation has been the ability to deliver higher doses of radiation. This significantly reduces the risk that the cancer will come back and leads to better outcomes for our patients. The main problem is that the prostate and the rectum are in physical contact with each other often, and that leads to higher rates of rectal side effects. So things like pain with bowel movements, frequent bowel movements, and irritation. A lot of technologies have been developed to try to improve on those side effects. Things like image-guided radiation therapy or intensity-modulated radiation therapy. But what I'll be speaking about is a new technology that allows a space to be made between the prostate and the rectum. It's a hydrogel, so it's a biopolymer that can be injected between the prostate and the rectum in a very simple outpatient procedure, and it increases the space between the prostate and rectum by about 1 centimeter. For radiation oncologists out there, 1 centimeter is a mile. You can get huge benefits in terms of the amount of radiation delivered to the rectum by getting that type of space. So for instance, in this randomized trial, half of the patients were treated with conventional image-guided intensity-modulated radiation therapy, and the other half were treated with fiducial markers and the hydrogel spacer. And the dose that was delivered to the rectum at 70 gray, what we call the V70, was reduced by about 75% in the experimental arm compared to the control arm. So the V70 in the control arm was about 10%, and the V70 in the experimental arm was about 2%. And what did that correlate with? That correlated with decreased rectal side effects in terms of how the physician scored it, and it also correlated with decreased rectal side effects in terms of how the patient scored it, or what we call patient-reported quality of life. So this was a trial that was initially presented 2 years ago here at ASTRO, and it was published last year in the Red Journal. And what we have now is the continued follow-up with median follow-up of about 3 years. And what we saw with added follow-up, not only did we continue to see the benefits that were seen initially with less rectal side effects and improved patient-reported quality of life, but if anything, those differences started to increase. And so this is really very exciting. I think this opens up totally new avenues for prostate radiation therapy. Things like stereotactic radiation therapy, or cyberknife radiation therapy, or even brachytherapy, which are other ways to deliver high doses of radiation to the prostate, could potentially all benefit from this type of a spacer, moving the rectum away from the prostate. And it's exciting data to look at, and glad to see that the 3-year data looks very good.